Just a nurse. That's what Dr. Pierce had called her in the break room 3 weeks ago, voice dripping with the kind of contempt reserved for people who existed to serve and never questioned why. Laura Bennett had been reaching for coffee when he said it, the kind of statement designed to land in silence and stick there. She'd poured the coffee. She'd walked out. No tremor in her hands. No heat in her chest. Just the mechanical precision of someone who'd learned long ago that showing reaction meant giving power away, and she'd spent the last 18 years not giving anything to anyone. Cedar Creek Medical in Norfolk smells like antiseptic and something underneath it, something that lives in hospital walls no matter how many times the cleaning crew scrubs. It's the smell of fear. Laura knows it the way she knows the difference between a pneumothorax and a hemothorax, the way she knows the sound a ventilator makes at 3 in the morning when everything else is dead quiet. She's standing in the ICU hallway at 0247 hours, the graveyard shift stretching in front of her like an ocean with no visible shore. When the fluorescent lights above her head buzz in that particular way, that means someone's walked under them on the 3rd floor and the electrical grid is getting lazy about it all. The night shift at Cedar Creek runs on skeleton crew protocols. One attending, for residents scattered across 2 wings, nursing staff that knows the unwritten rule: the less you ask for, the longer you keep your assignment. Laura has been working this unit for 8 months, long enough to know every monitor's pitch, every 4 pumps hum, long enough to move through the ICU with the kind of invisibility that comes from never asking for anything and never refusing anything either. She wears her competence the way other people wear cologne, a quiet announcement of professional capability that doesn't demand attention. Her hands are wrapped in latex gloves that hide the scar tissue on her knuckles. The scars are old now, the kind that only show white when the light hits them wrong. Field sutures without anesthesia leave marks like lightning tracks across skin. She'd done those sutures herself, in the field, on another nurse's hands while the mortar fire walked closer and closer across the compound roof. Pain is information, and her hands had been screaming that she needed to stop the bleeding, so she had. That was 2008. She's had 16 years to get good at hiding things. Inside the lining of her scrub jacket, at the level of her ribs, there's a faded patch. 5th Special Forces Group. The embroidery is worn almost invisible now from being inside, pressed against her body for 365 days straight since she arrived in Norfolk. It's the size of a postage stamp and it carries more weight than anything else she owns. Captain Laura Bennett, Army Nurse Corps, that's who's stitched into that patch in letters so faded that only someone who knew what they were looking for would ever see them. Not Lieutenant Laura Bennett, her actual rank. Captain. The rank of someone who commanded, who made decisions under fire, who signed off on blood products and surgical priorities when there was no attending physician and the helicopters couldn't land because the LZs were too hot. But that was before. Now she's just a nurse at Cedar Creek Medical, and Dr. Pierce had made sure everyone understood exactly what that meant. She checks the monitors on the central station as she passes, her eyes catching on room 12 where Major Garrett lies in semi-sedation, his toxicology panels pinned to the board above his bed like accusations. The labels read like a pharmaceutical catalog: benzodiazepines present, opioid metabolites, compounds the lab couldn't identify at all. The patient summary notes that he's a military transfer, brought in 3 weeks ago from a base rotation with symptoms that don't match any standard overdose profile. His heart rhythm keeps drifting in and out of irregular patterns. His oxygen saturation drops without warning. The attending physicians have settled into a consensus of bafflement, which is another word for powerlessness. Laura had recognized him the moment she walked into his room on her first shift assigned to the ICU. Major Seth Garrett. 3rd Battalion, 5th Special Forces Group. Commander of Bravo Company during the Ramadi rotation in 2007. The man who'd written a commendation letter about her son, about Private First Class Michael Bennett, who died outside Haditha in a convoy ambush and never came home. The man who'd called her house personally to tell her that Michael had died the way soldiers pray they will, with his squad around him and his weapon in his hands. That was 16 years ago. The letter from the Pentagon had arrived 4 months ago, routed through classified channels to her current residence. Military intelligence. It contained a single sentence: Major Garrett has been exposed to an unknown toxin during his deployment rotation. Monitor and report. Do not reveal your operational status. So Laura had applied for a transfer. She'd used her civilian nursing credentials, the one she'd maintained parallel to her military career specifically for operations like this. She'd accepted the position at Cedar Creek Medical. She'd sewn the patch inside her jacket lining and reported for duty. Dr. Pierce is at the nursing station when she arrives for her evening shift. He's 47 years old, with the kind of face that was probably handsome before arrogance carved itself into the features like graffiti on marble. He has a brother-in-law in the Norfolk District Attorney's office and a reputation for surgical precision that's undermined almost entirely by his bedside manner. He watches Laura approach the station with the kind of gaze that dismisses people, the way a man might look at wallpaper he's decided he no longer likes. "Bennett," he says without looking up from the electronic chart he's reviewing. "Room 12 is your assignment tonight. Continue current protocols. Try not to overcomplicate things." The last part lands with intention. There's no medical reason for it, no clinical rationale. It's a social statement, and everyone in the ICU hears it as such. Two residents glance up from their laptops. The evening charge nurse adjusts her posture. The communication is clear: this nurse will not be asked for opinions. This nurse will implement what she's told. This nurse exists to follow orders, not to generate them. Laura nods once. "Understood, Dr. Pierce." The words are deferential, correctly pitched, exactly what he expects. She doesn't raise her eyes. She doesn't challenge the implication. She simply accepts the assignment and walks toward room 12, and if her hands are steady in the latex gloves, if her breathing doesn't change, if every single muscle in her body stays exactly where it's supposed to be, then that's just what a competent professional looks like when she's receiving criticism from her supervisor. That's what Pierce thinks. He doesn't see the woman in the hallway 5 minutes later, standing outside room 12 with her hand on the wall. He doesn't see the way her jaw tightens for exactly 3 seconds before releasing. He doesn't see her eyes trace across Major Garrett's face, the lines that weren't there before, the weight loss that comes from medication interactions and toxins the hospital pharmacy can't identify. He doesn't see her checking the monitors with the precision of someone who's been trained to read vital signs the way other people read books, extracting information from patterns that look like chaos to the untrained eye. And he absolutely doesn't see the patch inside her jacket. No one does. That's the entire point of putting it inside, at the level of her ribs, where it lives against her skin like a second heartbeat. A reminder. A tether. An insurance policy against becoming so thoroughly invisible that she forgets who she really is. Laura adjusts Major Garrett's the line is running clear, the dressing is clean, the flow rate is exactly what the attending ordered. She checks the cardiac monitor. 78 beats per minute, regular rhythm, oxygen saturation 93%. She pulls a chair closer to his bed and sits down with the kind of stillness that takes years to develop. The kind that comes from learning how to be present without being demanding, how to hold space without taking up air. "I'm going to be right here," she tells him, her voice barely above a whisper. Not that he can hear her through the sedation. Not that he knows she's here as anything other than a nurse doing her job. But she says it anyway, because some truths only matter if they're spoken aloud, and because Major Seth Garrett, who once signed a letter recommending her son for a Valor decoration, deserves to know that someone is standing watch. The night stretches ahead like something solid. The monitors hum their electronic hymn. Somewhere above her, on the second floor, a patient is calling for help that no one will answer for at least another 10 minutes because that's how skeleton crews work, they work until they don't. And that's when the real nightmare begins, though Laura doesn't know it yet. Doesn't know that Dr. Pierce is currently having a conversation with the chief of medicine, a conversation that includes carefully selected phrases like protocols and workplace safety and the kind of professional jargon that sounds innocent until it's had time to settle into someone's personnel file like sediment in a bloodstream. But tonight, in room 12, with Major Garrett's hand cold under her fingers and the patch inside her jacket pressing against her ribs with every breath, Laura Bennett is exactly where she's supposed to be, invisible, competent, and watching. The morning rounds began like every other morning at Cedar Creek Medical, fluorescent lights humming their mechanical hymn, the ventilator in room 12 wheeling its rhythmic breath, the smell of antiseptic layered over something underneath it, something organic and failing. Laura stood at the medication cart outside Major Garrett's door, updating his for fluids, when Dr. Pierce arrived with his entourage of surgical residents trailing like remora fish behind a shark. He was already talking before he entered the room, his voice carrying that particular timbre of a man accustomed to being obeyed without question. "Nurse Bennett, or should I call you Florence Nightingale, who authorized you to recommend adjusting his anticoagulant protocol?" Pierce's shadow fell across the cart, deliberately blocking her light. She didn't look up. Her hands remained steady as they always remained, hands that had held pressure dressings against arterial wounds under mortar fire, that had performed field triage in Ramadi with rounds snapping overhead like angry hornets. This was nothing. This was air. "Did you suddenly earn an MD while restocking bedpans?" Pierce's voice rose another decibel, performing now for the surgical team gathering at the glass partition of room 12. She could feel their eyes on her, the residents with their fresh credentials and their careful distance from conflict, the nursing supervisor pretending to review a chart, the respiratory therapist suddenly very interested in the ventilator settings. Laura turned and walked into the room with Pierce, closing the door with deliberate quiet. The sound of it clicking shut made her realize how much she hated that sound, the sound of doors closing her into spaces with men who had forgotten what it felt like to be afraid. "You're a nurse." Pierce's voice dropped to a stage whisper, the kind designed to carry. "Your job is to follow orders, not play doctor with a patient who's already circling the drain." He gestured dismissively at Major Garrett's monitor, where the numbers traced their fragile mathematics across the screen. The bed rails were cold steel under her periphery. She could see them with her eyes closed. She could see everything with her eyes closed, the 4 lines color-coded like a map to somewhere that wasn't here, the catheter bag half full with urine the color of weak tea, the monitor displaying a heart that was working too hard to stay in rhythm. She stood perfectly still, arms at her sides now instead of clasped behind her back, her posture the kind that looked like submission but felt like a coiled spring. She counted the seconds. 1, 2, 3. Your malpractice carrier must love how often you confuse incompetence with insubordination. The words came out in a voice like frozen steel, flat and precise, each syllable a separate decision. Pierce's face went the color of arterial blood. She watched his jaw clench, watched the flush creep up his neck, watched him open his mouth and then close it because there was nothing to say to that, nothing that wouldn't make him look worse in front of the residents who were suddenly very interested in their shoes. She walked past him without another word, without a glance back, and the room exhaled as if it had been holding its breath. The door clicked shut again. She was already 3 steps down the hallway when she heard him snap at the nearest resident, "Well? Move. I haven't got all day." The next morning, a disciplinary notice appeared on the unit board in the break room. Laura saw it while pouring coffee, the black text on white paper carrying more weight than paper should carry. Disciplinary action, L. Bennett, unauthorized medical recommendations, final warning. The words blurred slightly, then came back into focus. She sipped the coffee black, watching the steam rise in thin columns, and felt the faded unit patch sewn inside her scrub jacket press against her ribs like a second heartbeat. The 5th Special Forces Group insignia, invisible but present, a reminder that she had done harder things than read her own humiliation posted for the entire shift to see. She had folded the flag over too many coffins. She had performed emergency procedures in conditions that would make this fluorescent break room look like a 5-star resort. She had stared down interrogators and held her silence like a weapon. That afternoon, the exodus began. Laura sat at the break room table with her sandwich, turkey and mustard on whole wheat, the kind of lunch that took for minutes to prepare and longer to eat, and waited. She knew it would come. She had read the signs in the way people looked away, in the way conversation stopped when she approached, in the deliberate choreography of rejection that Pierce had orchestrated like a conductor with perfect pitch. Dr. Chen looked up first, glancing at his watch as if suddenly remembering an urgent appointment elsewhere. He stood without speaking. Then 3 nurses stood in sequence, each one waiting just long enough to make it look independent, spontaneous, not orchestrated. Dr. Saunders stood next, his departure accompanied by the scrape of his chair against tile. The respiratory therapist stood. The medication aide stood. The entire room rose in a wave, a exodus, a collective decision that Laura Bennett was not worth the space she occupied at a cafeteria table. The last person to stand was Dr. Vargas, who made a point of speaking loudly enough for her to hear, "I don't sit with people who think they're smarter than physicians." The silence that followed had texture. It had weight. Laura took another bite of her sandwich and chewed slowly, deliberately, the way a sniper waits. She did not look up. She did not let her eyes follow them to the door. She simply sat at the table, alone, with her sandwich and her cold coffee and the knowledge that every person who had left just validated exactly why she was here. They didn't know. None of them knew what she was. They thought they were rejecting a nurse who had overstepped. They were actually rejecting a captain in the United States Army, a decorated intelligence officer, a woman who had spent 18 months learning to disappear into a small Norfolk hospital because her son's commanding officer had been poisoned and nobody else could find out why. She was invisible by design. Their exclusion was perfect cover. The water glass in front of her reflected the fluorescent lights back at her like a surveillance camera, and she studied her own face in that reflection. The composure was intact. The mask was seamless. Not a tremor. Not a hesitation. Just a woman in scrubs eating lunch alone, which was exactly what the world was supposed to see. The third humiliation came during the mandatory staff meeting on Thursday, the one Pierce attended with the chief of medicine, Dr. Reynolds. The meeting room smelled like stale coffee and something chemical, the cleaning solution they used on the tile floors, industrial strength, designed to strip away organic material. Laura sat in the third row, her hands folded on the table in front of her, and waited. She had already seen the disciplinary documentation. She knew what was coming. You didn't survive 3 tours in theater without learning to recognize when the hammer was about to fall. The only question was whether Pierce would have the satisfaction of watching her reaction. "Nurse Bennett." Dr. Reynolds' voice carried the tone of a man reading from a script that had already been written by someone else. He didn't look directly at her. "We have received multiple reports regarding your conduct on this unit. Patient care coordination, medication recommendations, and creation of a hostile work environment through persistent boundary violations." He held up a folder, her folder, she realized, the one that Pierce had been building. "This behavior stops now. Effective immediately, you will be restricted from direct care in the ICU. You will work day shift only, under direct supervision. Any further protocol violations will result in immediate termination." The folder slammed shut with a sound like a gunshot. 20 faces turned to look at her. 20 sets of eyes, waiting to see if she would cry, if she would defend herself, if she would do anything other than sit there and accept her own destruction. Laura nodded once. Just once. Understood. Her voice was quiet, measured, the voice of someone who had made a decision about what her face would show and what it would hide. She sat back down and felt rather than saw Pierce's satisfaction radiating from wherever he was standing in the room, probably near the door, she thought, probably already moving on to whatever was next, already confident that he had won. That night, working her final shift in the ICU before they moved her to day shift and supervised patients, Laura pulled Major Garrett's chart from the system and began scanning the billing codes. It didn't take long to find them. Ventilator rental charges for equipment that Cedar Creek owned outright, a Model 840 that had been purchased 3 years ago, yet the system showed monthly rental fees dating back 2 years. 3 times the market rate for oxygen supplies. Cardiac monitoring equipment billed as leased when it came with the room. She photographed 2 pages on her phone, her movements casual, her face blank, before she heard the footstep behind her. The fluorescent lights had dimmed to their late shift frequency, giving everything a quality like underwater footage. She knew who it was before she turned. "Accessing patient files outside your assigned duties, Bennett." Pierce's voice came from the shadows near the nurse's station. "That's a HIPAA violation. That's termination." She closed the screen without hurrying. "He's my patient. I'm reviewing his history." "Not anymore." Pierce stepped closer, and she could smell coffee and something else, something like expensive cologne trying to cover the smell of sweat. "You're becoming a liability. I've documented 15 protocol deviations in 3 weeks. One more and you're done. And this time I'll make sure there's no appeal." Laura met his eyes with the flat interrogator stare she had perfected in rooms where the stakes were higher and the men were more dangerous. Pierce held her gaze for exactly 4 seconds before stepping back. He had made the mistake of thinking physical proximity would intimidate her. He did not know that she had been close enough to smell the fear on men who had been willing to die rather than talk, and she had sat quietly while they chose their own silence. Compared to that, Dr. Pierce was nothing but a shadow against the hum of machines. That night, Major Garrett's monitor began its warning song. Laura was 3 rooms down when the alarm started, a series of high-pitched chirps that escalated to the kind of urgent beeping that made the entire unit move. She was moving before the rapid response announcement finished. Code Blue. Room 12. The heart rhythm on the monitor showed atrial fibrillation degenerating toward something worse, the electrical system of his chest misfiring like an engine about to seize. 7 doctors arrived in sequence, Pierce first, then Saunders, then Chen, then Vargas, then Morrison, then Rashid, then Cole. 7. The exact number she would remember later when everything changed. They stood around the bed like a committee of failure. Laura provided the initial vitals from the monitor, the oxygen saturation dropping toward dangerous numbers, the heart rate climbing toward the ceiling. They stabilized him temporarily using medications, epinephrine, amiodarone, the drugs hitting his system like small explosions designed to restart the electrical rhythm. It worked. Sort of. His heart found a rhythm, not the clean sinus rhythm they needed but something functional, something close enough that it looked like survival. She watched the monitor climb, 60 beats per minute, then 65, then holding at 72. The oxygen saturation recovered to 94%. Stable. For now. "I'm restricting your access to room 12, Pierce announced afterward, pulling her aside with a gesture that was meant to look casual to anyone watching. Dr. Chen will take over his care. Full-time assignment." Laura's jaw tightened, the only crack in her composure, a single muscle contracting, visible only if you knew how to look for it. "He responds to my voice. I've been his primary nurse since." "That's exactly the problem." Pierce's voice dropped, and she realized this was what he had wanted all along, not to save the patient, not to provide good medicine, but to remove her from the room. To disconnect her from the one connection that mattered. "You're too involved." "Professional distance, Bennett. It's what we call boundaries." She watched through the glass as Dr. Chen adjusted medications the next shift, following Pierce's orders, while Major Garrett's readings drifted sideways, the numbers sliding toward something that looked like a slow descent. The patch inside her jacket burned against her skin like a brand. Her son's commanding officer was dying and she was being systematically blocked from helping him. The fluorescent lights hummed their endless song. Somewhere in the hospital, Pierce was probably already moving on to the next phase of whatever this was, the fraud, the manipulation, the careful construction of a narrative where Laura Bennett was the problem and everything else was procedural protocol. She had spent 18 months invisible. She had been rejected and humiliated and restricted. The mask was still perfect. The composure was still intact. But underneath, in the place where she kept the memories of Ramadi and the faces of soldiers she couldn't save, something was beginning to move. Something that had been patient and quiet was starting to wake. The fever climbed. That was the first thing Laura noticed when she pulled Garrett's chart at 2,140 hours on a Tuesday, his core temperature creeping upward despite the cooling blanket, his cardiac enzymes rising in a pattern she'd seen before. In Ramadi. In the field surgical tent at Forward Operating Base Shank, when soldiers with exposure to certain chemical compounds started showing similar trajectories, fever, then bradycardia masking as normal, then the sudden catastrophic decompensation that left them dead before the helicopter could land. She stood at the nurse's station, fluorescent light casting everything in the color of old bone, her eyes moving across the lab values on the screen with the same precision she'd once used to read interrogation subjects for signs of deception. Elevated troponin. Abnormal QT interval. The potassium levels drifting in the pattern of someone methodically destabilizing cardiac function through calculated medication interactions. Not accident. Not natural decline. Someone had been adjusting his sodium channel blocker timing, introducing a diuretic at the exact moment it would trigger electrolyte cascade, creating a pharmaceutical trap that looked like natural heart failure to anyone not trained to see the deliberate architecture underneath. Pain is information. That was something she'd learned a long time ago, before she became a nurse, before she learned to fold her military past into something invisible. The pain she felt watching Garrett's decline, not emotional pain, but the sharp clinical pain of recognition, told her everything she needed to know. Whoever had poisoned him wasn't done. They were patient. They were professional. They were inside Cedar Creek Medical, adjusting his medications with the precision of a field medic, which meant they'd had access to someone inside this hospital who knew exactly what they were doing. By Thursday, his condition had deteriorated enough that Dr. Saunders called an emergency cardiology consult. Laura watched from the hallway as the consulting cardiologist spent 40 minutes examining Garrett, reviewing his EKG strips, studying the echocardiogram images like a man trying to read meaning in static. The doctor's face told her what his mouth wouldn't say out loud: this didn't make sense. A 52-year-old officer with no significant cardiac history shouldn't be showing signs of acute heart failure progression this rapid, this aggressive. Something was wrong with the entire clinical picture, the way a single discordant note ruins an otherwise perfect symphony. She'd been assigned to other patients now. Dr. Pierce had made that official during rounds, his voice cutting across the ICU like a scalpel. Bennett, you'll be covering beds 8 through 12, not 6. That's Dr. Hernandez's assignment now. A junior resident with 6 weeks of ICU experience and a propensity for accepting physician orders without questioning the clinical rationale underneath. Smart tactical move. Isolate her from Garrett. Remove her eyes from his care. Make it look procedurally justified, like routine rotation management, while actually severing her access to her mission target. She watched anyway. That was the training talking, the part of her that had learned in Ramadi that information asymmetry was survivability. From a terminal at the opposite end of the ICU, she could see Garrett's monitor through the window of his room. She could track his vital signs, memorize the nurse call pattern, note when medications were being pushed and by whom. She pulled his chart during her break, officially just reviewing a patient she'd previously cared for, nothing suspicious, nothing that violated any protocol. The medication administration record showed exactly what she'd suspected: someone had changed the timing on his beta blocker, shifted the potassium-sparing diuretic to a more dangerous timing window, and introduced a QT-prolonging antiemetic that shouldn't have been anywhere near this patient's med list. The signs were so clear that she had to force herself not to say anything, not to flag it to anyone, not to reveal that she understood what was happening. That was the hardest part of the operation. Not the deception. Not the isolation. Not the endless nights folding her uniform and pressing each crease with mechanical precision while her mind ran through scenarios and contingencies and worst-case timelines. The hardest part was watching someone slowly killed in front of you and having to maintain silence while the machinery of institutional medicine ground forward, indifferent, blind, complicit through negligence. At 0200 hours on Friday, the monitor alarm shrieked. Laura heard it from her assigned patient's rooms, the distinctive pattern of ventricular tachycardia degenerating toward fibrillation, and her body moved before her mind engaged. She was moving toward room 6 when she heard Dr. Saunders' voice calling a code, heard the rapid percussion of feet on tile as the code team assembled. She approached the room but stayed in the doorway, watching. Dr. Saunders was already performing compressions, his hands locked in the center of Garrett's chest, pushing hard and fast, the compression depth eating into the man's breastbone with the rhythm of a pneumatic hammer. One of the nurses was charging the defibrillator, charging, and the whine of the capacitor climbing filled the room like a siren compressed into a single note. Laura's eyes tracked the monitor: ventricular fibrillation, absolutely no organized electrical activity, the kind of rhythm that killed soldiers within minutes if the chain of survival broke anywhere along its critical path. They got him back. At 3 minutes, after the second defibrillation, the monitor registered a return of spontaneous circulation, the blessed sinus rhythm appearing like a reprieve, and everyone in the room exhaled in unison. Dr. Saunders stepped back from the compressions, breathing hard, his eyes still locked on the monitor as if he expected the rhythm to collapse again at any moment. That was when Dr. Pierce entered the room, his presence announcing itself before his body even cleared the threshold. His eye swept the scene, registered Garrett's stable rhythm on the monitor, then found Laura standing in the doorway. The moment lasted perhaps 2 seconds, but it was enough: recognition, assessment, decision. "You're not assigned here, Bennett." His voice carried the precision of a court judgment. "Leave." She left. Walked backward, turned, moved down the hallway with her face arranged in the expression of someone who'd simply wandered into the wrong room and accepted redirection. But from her position at the medication dispensary 20 feet away, she watched the ICU through the partial wall of the nursing station. Watched as Pierce conferred with Dr. Saunders. Watched as something unspoken passed between them, a glance, a small nod, a decision crystallizing in the space where words couldn't go. For hours later, at 0600 hours, the monitor alarmed again. This time Laura was officially off shift, supposed to be heading toward the parking lot, toward her car, toward the suspension Dr. Pierce had threatened during rounds. But the alarm was a shape she recognized, the particular cadence of a heart in distress, and her feet had already turned before she'd consciously decided to move. The second code was chaos. Less organized than the first. Dr. Vargas was leading compressions now, and he was frantic, his movements too fast, his rhythm uneven, the textbook technique dissolving under stress like watercolor in rain. A respiratory therapist was bagging Garrett manually, the whoosh of the bag valve mask sounding desperate and too rapid. And nurse was pushing epinephrine, pushing atropine, pushing every drug in the ACLS algorithm, hoping something would restart the electrical system that had flatlined completely. They revived him again. At 5 minutes this time, just as Laura was thinking that the hypoxic window was becoming critical, the monitor registered organized electrical activity again. Sinus rhythm. Another reprieve. Another temporary victory against the machinery of systems designed to kill him. And this time, Laura understood what was happening. This wasn't natural decline accelerating. This was deliberate. Someone was creating the conditions for Garrett to crash, allowing just enough time for the code team to revive him, then letting him decompensate again. It was calculated cruelty, not attempting to kill him outright, but instead creating a cascade of cardiac arrests designed to look like either natural deterioration or some infectious process or the long slow machinery of a body finally giving up. For crashes in 1 week? The chart would show a terminal decline. The family would accept the inevitable. The death would be documented, closed, buried under the weight of other cases and other losses. She was at the terminal again, pulling his medication administration record with the particular speed of someone moving against a deadline they could feel but not quite name. There. Right there. The diuretic pushed at 2000. The beta-blocker timing changed at 2030. The QT prolonging antiemetic added at 2145. Someone had orchestrated this sequence with the precision of a military operation, each medication time to create maximum cardiac instability at maximum separation from whoever might notice the pattern. Dr. Pierce was standing beside her before she realized he'd approached. She sensed him first as a presence, a disturbance in the air pressure, the way prey animals sense a predator. He was holding a piece of paper, and his face had arranged itself into the expression of someone performing an unpleasant but necessary duty. Persistent insubordination, he said, his voice carrying the weight of institutional authority. Accessing records outside your assignment. Presence in restricted clinical areas during suspension notice. Pack your locker, Bennett. You're terminated pending administrative review. Security will escort you out at end of shift. Laura turned to face him. The fluorescent lights hummed their monotonous frequency above them, and for just a moment, something shifted in her composure, something cracked, just barely visible, just enough for him to see that he'd made a tactical error. Her voice dropped 3 octaves, became something quiet and shaped like steel. If he dies because you blocked competent care, there won't be enough paperwork in the world to protect you. She let each word sit in the air for its own moment. Not from what's coming. Pierce's face blanched. Then flushed. His jaw worked as if he wanted to speak, but something in the particular clarity of her voice, something that contained information he didn't have, that suggested knowledge and reach and consequences he couldn't calculate, kept his mouth closed. He turned and walked away, his stride just slightly faster than it should have been if he was trying to maintain the appearance of professional composure. But that wasn't the worst part. At 0600 hours, as Laura was finishing her shift notes, as the morning light was beginning to pale the eastern windows, the monitor alarm shrieked for the third time in 12 hours. The code blue announcement came over the intercom, calm, professional, the voice of someone reading a script. Code blue, ICU bed 6, code blue, ICU bed 6. And this time, Laura was supposed to be gone. Supposed to be off the floor. Supposed to be in the parking lot or halfway to her apartment or anywhere except where she was about to go. She moved anyway. That was muscle memory. That was training taking over from judgment. That was the part of her that had lived in Ramadi and seen what happened when competent people walked away from wounded soldiers, the particular kind of death that came not from the enemy but from the failure of courage in the people who should have known better. She arrived at room 6 to find 7 doctors. The monitor's scream cut through the ICU at 0200 hours like artillery incoming. Flat line. Every alarm firing at once, the ventilator clicking faster, the crash cart's wheels shrieking against linoleum as Laura's hands moved before her brain caught up. She was 3 rooms away when the code blue announcement hit, but she was already running, muscle memory pulling her toward the sound the way her body had always run toward the wounded. Room 12. Major Garrett. The chart at the bedside showed his heart had simply stopped, no warning arrhythmia, no gradual decline, just a sudden silence where there should have been a rhythm, and she understood in that moment what the poisoning looked like when it came for the heart. Dr. Pierce was already there, standing at the foot of the bed with his arms crossed, not reaching for the crash cart, not ordering compressions. Laura burst through the doorway and went straight to Garrett's chest, one hand on the sternum, and Pierce's voice cut across the chaos like a knife. His DNR by proxy. His command authorized comfort care only. The words were precise. Practiced. The kind of lie that slides smoothest when delivered with absolute confidence. Laura's hands didn't stop. She was checking for a pulse, nothing, just the cold collapse of a body without blood pressure, and she looked at the chart clipped to the bed rail. Empty. No DNR paperwork. No orders. Just a blank signature line where authorization should have been. That's not in his file, Laura said, her voice flat as the monitor behind her. Pierce's face hardened into something carved from stone. It's verbal authorization. We're done here. Step back. He turned and walked out of the room like a man who expected to never be questioned, the kind of certainty that comes from knowing the system will back you up when you speak it loud enough. Laura pressed the call button for additional staff and began compressions on her own, her hands finding the space between Garrett's ribs, the rhythm automatic, 30 compressions, airway management, repeat. In Ramadi, she'd done this in a tent with mortar rounds walking through the walls. Here, in a climate-controlled ICU with equipment worth more than her annual salary, she was alone. Dr. Saunders appeared 2 minutes later, already shaking her head before she crossed the threshold. The liability exposure is too high. We've coded him 3 times already. I'm sorry, but I can't. She didn't finish. She just turned and left, her white coat moving toward the exit like she hadn't just watched a patient's heart stop in front of her. Laura didn't break rhythm. She called out, "Somebody push 1 milligram epi." But the room was emptying instead of filling. Dr. Chen arrived next, and the exhaustion on his face was real, 16, maybe 18 hours on shift, the kind of tired that makes decisions for you, but he looked at Garrett, then at Laura, then toward the door. I've been on double shift. I can't do this. Gone. Dr. Vargas suddenly remembered a consult across campus, something urgent, something that couldn't wait, his scrubs rustling as he made for the hallway with the careful deliberation of someone ensuring he wouldn't be asked a direct question. 7 doctors. Laura was counting them the way a soldier counts remaining ammunition. Dr. Morrison's phone rang, the timing so perfect it seemed orchestrated, and she answered it with visible relief. "I have to take this. I'm sorry." "Out." Dr. Rashid approached the bedside, his posture respectful, his voice careful with the weight of something he'd prepared to say. "I have religious objections to experimental interventions without explicit family consent. I cannot participate." He bowed slightly and withdrew. 6. Dr. Cole was the last one, and he at least had the courtesy to look directly at her when he shook his head. "He's gone, Bennett. Let him go." His voice wasn't unkind. It was worse than unkind. It was gentle. The kind of gentleness that comes from pity, from someone who decided her effort was already a waste of everyone's time. He left her alone in the room with a patient who was running out of heartbeats, with a monitor that was flatline and falling, with the knowledge that 7 doctors had just walked away from a code blue and closed the door behind them like they were walking away from a mistake. 7. The specific geometry of abandonment. Laura kept her hands moving, kept the compression steady, kept her breathing controlled even as something inside her chest tried to crack. The room was silent except for the ventilator and the compression sounds. She was creating all of it now, every oxygen exchange, every cardiac output, everything that was keeping Major Garrett tethered to life was coming from her hands. The monitor showed no change. No electrical activity. No hope written in any of the numbers. And then she heard Pierce's voice from the hallway, the sound carrying through the open door. He was on his phone, already spinning the narrative, already ensuring that what happened next would be her failure, not his abandonment. She stopped compressions for exactly 3 seconds. Long enough to reach the surgical tray on the bedside table. Long enough to find the scalpel. Long enough to feel the weight of it in her palm, the same weight it had had in Ramadi, when there was no surgeon 6 hours away, when the choice was a cut or a corpse. Her hands moved without asking permission from anyone in the hierarchy above her. Between the 4th and 5th ribs, the scalpel went in with the kind of precision that only comes from doing something before under circumstances far worse. The fascia opened like muscle memory made manifest, the incision clean, and then her hand was in his chest cavity, her bare fingers finding his heart, and the feeling of it, still, cold, stopped, was the same as it had been in the blood tents of Ramadi. She began manual massage, her hand working the muscle back into cooperation, back into the rhythm that meant life instead of the flat line that meant everything she'd sacrificed to hide had been for nothing. 30 compressions with her bare hand. 60. Her skin was warm and his heart was not. The ventilator hissed. The monitor continued its electronic silence. And then, blip. A single electrical spike. Her hand felt it before the monitor called it, felt the heart shudder under her palm like it was remembering something important. Blip. Blip. Rhythm. Sinus rhythm returning, the monitor climbing from flatline to something that looked like hope, something that looked like a heartbeat that might keep the Major alive long enough for someone to figure out what poison was killing him from the inside. Pierce appeared in the doorway at the moment the sinus rhythm stabilized. His face was the color of someone who'd just watched an entire institutional narrative collapse in real time. He was already reaching for his phone, his voice cutting through the room like something with teeth. "This is Dr. Pierce. I need security and hospital administration immediately. I have a nurse performing an authorized surgical intervention by non-physician personnel. Patient safety violation. Immediate response." Laura didn't look at him. She pulled her hand from Garrett's chest, grabbed a suture kit from the tray, and began closing the incision with the same mechanical precision she'd used in field hospitals where there was no tomorrow to worry about, only the next breath, the next stitch, the next moment the patient stayed alive. By 02:45 hours, Garrett's incision was closed, his vitals were holding, and the chart finally showed what she'd known all along, a cardiac rhythm that looked almost normal on the oscilloscope, a man whose heart was beating because she'd put her hands inside his chest and forced it to remember how. By 0800 hours, she was sitting in Director Reynolds' office with her badge on the desk between them, and she wasn't shaking. Her hands were steady. Her voice was steady. Everything about her was the kind of calm that comes from having already lost everything that mattered and deciding the rest was just logistics. "I understand the hospital's position," she said quietly. By noon she was in the hospital laundry room, pressing the wrinkles out of her blood-stained scrubs with methodical care, folding each piece the way she'd learned in the army, squares and rectangles, everything aligned, everything controlled. The blood on the fabric was mostly dried now, brown instead of red, the reminder of what she'd done sitting in her hands like a consequence she'd already accepted. The faded unit patch from inside her jacket was in her pocket. She took it out and looked at it, the 5th Special Forces Group insignia, frayed at the edges, the colors muted by time and the weight of secrets. She'd sewn it in the lining of her scrub jacket on her first day at Cedar Creek Medical, a marker that nobody would ever see, a truth that lived in fabric. Pierce had won with paperwork. With protocol. With the specific institutional certainty that comes from knowing the system backs up doctors, not nurses. And Major Garrett, at least for now, at least for tonight, was still alive. But without her there to watch for the next phase of the poisoning, without her there to catch what 7 doctors had already missed, he would die in his sleep or during a shift change or sometime between lunch and the afternoon blood draws, and nobody would know it was deliberate. She folded the last scrub and set it on the pile with all the others. Pierce was already dialing before Laura's hand stopped moving. The scalpel clattered into the surgical tray, a sound like a gunshot in the silence, and his voice carried through Major Garrett's ICU room with the precision of someone who'd spent 8 months practicing this exact moment. Yes, this is Dr. Pierce. Code Blue in ICU 7. Unauthorized surgical intervention by non-physician personnel. Patient safety protocols violated. I need administration and security immediately. His jaw tightened as he watched her hands work, watched the color return to Garrett's face, watched the monitor climb from flatline to something that looked like a heartbeat, and it infuriated him because none of that mattered now. He'd already won. The paperwork would say what he needed it to say. The witnesses would say what he needed them to say. 7 doctors had already walked away, 7. That was his armor now. 7 physicians who'd chosen safety over intervention, who'd let him be the voice of reason in the room. Laura didn't look at him. Her focus stayed on Garrett, on the 4 lines, on the oxygen saturation climbing on the monitor, 88%, 91%, 94%, but her shoulders shifted slightly, the smallest tell, and Pierce recognized it as the moment she understood. The mission was over. The cover was blown. By 02:47 hours, security was in the room. By 03:06, she was being escorted from the ICU. By dawn, she sat across from the director in a mahogany office that smelled like leather and old money, her hospital badge already surrendered, her hands folded in her lap like she was waiting for a meeting that had nothing to do with her life collapsing. The director read from a prepared statement, not meeting her eyes. The incident with Major Garrett, while your intentions may have been concerned, represents a serious breach of protocol. Our liability insurance cannot cover an authorized surgical intervention, regardless of outcome. He paused, waiting for her to argue, to defend herself, to show some sign of the panic he was clearly expecting. Laura didn't move. The hospital has decided to accept your resignation, effective immediately, pending a full investigation into the incident. She nodded once. A single, controlled movement. The director shifted in his chair, uncomfortable with her silence the way Pierce had always been uncomfortable with it. Severance will be processed. Confidentiality agreement included. This stays between us. Another nod. She stood, and he seemed relieved to have her leave, relieved to not have to watch her anymore. The badge went onto his desk with a soft click. She walked out of his office at 05:27 hours, past the morning shift arriving for day coverage, past the nurse's station where someone whispered her name, past the bulletin board where Dr. Pierce's disciplinary notice had been posted weeks ago and was now coming down, being replaced by something that would matter to nobody until it mattered to everyone. The hospital laundry room was where she went next. Not because she had to. Because she needed to sit somewhere the fluorescent lights didn't hum like they were alive, somewhere the smell of bleach and industrial detergent could burn away the rest of the night. The blood-stained scrubs were in an isolation bag marked for disposal. She pulled them out instead, ran them through the industrial washer twice, then brought them to the fold station with the precise movements of someone who'd done this before, who'd folded things that mattered far more than fabric and blood. Each scrub top was laid flat, sleeves folded inward, the bottom third folded up, then in half again. Press. Hold. Release. The mechanical precision of it, the same precision she'd used to fold a flag over a coffin in Arlington, rain hammering the grass while her son stood in dress uniform with his eyes forward and his grief locked down tight. Press. Hold. Release. The third scrub top was the one saturated with Garrett's blood, rust-colored now, already drying into the cotton weave. She folded it anyway. The crease had to be perfect. That's what the detail meant: perfect folds, perfect creases, perfect control even when everything else was falling apart. She was halfway through the fourth scrub when she heard footsteps on the tile, and Pierce walked past the open laundry room door with something that looked like vindication in his posture. He didn't stop. He didn't even glance at her. He just walked past with his shoulders a fraction higher than they'd been last week, his stride a fraction longer, his face wearing the expression of a man who'd successfully eliminated a problem. The door to the laundry room swung closed behind him. Laura set down her scrubs and pressed her forehead against the fold station, breathing through her nose, letting the bleach fumes clear her head. Garrett would crash again. Without her watching the monitors, without her reading the data that 7 doctors had somehow missed, the poisoning would progress. It would take another form, subtle, cardiac, the kind of deterioration that looked like age instead of sabotage. She had maybe 72 hours before Garrett's condition degraded past the point of recovery. 72 hours for her mission to be completed or abandoned. 72 hours before a decorated Special Forces officer died in a hospital bed while Dr. Pierce walked around Cedar Creek Medical believing he'd won with signatures and protocol violations and the weight of 7 physicians' cowardice. But that wasn't what would happen next. That wasn't how this ended. 3 miles away, at Naval Station Norfolk, a junior officer was reviewing incident reports. Routine traffic. 6 pages on a night shift emergency at Cedar Creek Medical, flagged for military connection because the patient was Major Thomas Garrett, 3rd Battalion, 5th Marines, Dark Horse Company. Routine escalation to command. A 5-star general receiving a brief on a subordinate's hospitalization. A telephone call from the Joint Chiefs of Staff asking why a decorated combat veteran's medical records contained surgical intervention by non-physician personnel. And then, in a classified database that existed in exactly 4 locations in the continental United States, a flag on a name appearing in Cedar Creek Medical's personnel roster, Captain Laura Bennett, 75th Ranger Regiment, attached to Task Force 121, Security Clearance Level Zulu Alpha, Embedded Hospital Assignment Classified. The flag triggered an automated alert. The alert triggered a phone call. The phone call triggered something that would arrive at Cedar Creek Medical in exactly 71 hours, and when it did, Dr. Pierce's victory would evaporate like blood under a black light. Laura folded the last scrub top and set it on the pile with all the others, each crease perfect, each fold executed with the precision of someone who understood that sometimes the only power you had left was the power to wait, and sometimes waiting was the most lethal weapon in the room. If you're still watching, hit that like button. And I want to know, would you have saved the man who fired you, or walked away? Drop your answer in the comments. Subscribe and let's see how this ends.